is a problem when in this nation 50 million Americans do not have the opportunity while working to be able to receive health care if they lose their jobs. This is ridiculous. Our workforce is the power of America. Our workforce is what makes us strong. Our workforce is what gives us the power to be able to move forward and to compete on the world stage. Without having health care insurance, we cannot compete effectively. We can't. It is ridiculous that we are in a country that does not provide this basic fundamental right. It's ridiculous. We must do better. We have to. When I see patients come in the door and they say, we can't afford to see you any longer, it is wrong. It is wrong for us to see patients over and over for conditions that can be treated and managed better, but they can't afford these treatments. It's unfortunate when patients miss follow-ups and don't arrive because they can't afford co-pays or they haven't met their deductibles. It's ridiculous that there is so much we have in America, but we can't take care of our own. I believe, as a businessman, healthcare has impacted us in a strong way because it means that we are no longer able to provide the kind of competitive jobs that Virginians need. We are able to hire people, but financial issues that our business has to face today, it becomes one of the toughest emotional decisions that we have to make. When you think about the cost of healthcare, it becomes politicized. It becomes politicized in a way that says, well, how are we going to afford it? How are we not going to afford this? There is no way that it can be effective if we don't do something now. When I went to Washington, I met with some congressmen, and many of them have heard us. Many of them understand that it is imperative that we do something right now to bring about the kind of change that is necessary in healthcare. I heard some stories that would make you cry. I've seen people day after day after day struggling to make it and fall on hard times and lose their health care, lose their hard-earned resources, and have nothing to show for it. It's time for this to change. When I went to Senator Mark Warner's office, we were hustled to the back stairway. When we were brought to the back stairway, we were given a cursory listen to, and then we were hurried off down the elevator. We were not heard. I want you to understand something. Today, we should be heard. Today, we should be heard for what is now the most important issue our country faces. If Patrick Henry stood here saying, "Give me liberty" or "give me death," or whatever quotation he quoted, he was calling on a great nation to do something great, to change, to be something that is greater than what they thought they could be, to do something bigger than what they thought they could do, to reach out farther than where they thought they could reach. I'm calling on this nation. I'm calling on this great Commonwealth. I'm calling on our congressmen. I am saying pass affordable health care now. Not tomorrow. Tomorrow is not going to help my pregnant wife. Tomorrow is not going to help the many cancer survivors. Tomorrow is not going to help those individuals who are suffering right now, who are working hard. Tomorrow is too late. This must be passed now.
Now I'd like to introduce Lauren Ray, a local small business owner. She owns a business called Banner Ideas Online, and she's going to talk to you a little bit about the plight of the underinsured.
Hello, thanks for having me out today. My name is Lauren Ray, and I speak today both as a mother and and a student, but more importantly, a small business owner. 5 months ago, my fiance and I bought his small family business, and we now run Banner Ideas Online, which is a flag and banner company and specialized in decorative flags. Due to a health insurance loss by both of us while I was pregnant, and a subsequent hospital stay while I was uninsured, before our daughter was born, we had already accumulated over $20,000 of hospital and medical bills. After taking over the company, we were finally able to afford to purchase private insurance. However, the only coverage we could afford was sparse and included little care. In the 5 months we have had this policy, we have accumulated, as of today, more than $4,000 of unpaid bills and unpaid visits that they deem is either pre-existing condition, doesn't meet the deductible, and as of today we have yet to get any of our claims fully covered. The money we pay for our policy makes it virtually impossible to run a successful business. We, due to our previous and current medical issues and the debt that we have incurred by those crises, our credit has been destroyed and prevents us from obtaining small business loans that would make our business more competitive. We are on a cash and carry basis with most of our vendors, and cash flow issues prevent us from being able to invest in marketing and advertisement. We are also unable to afford to provide any kind of benefits to employees, which forces us to run the business alone, thus making it impossible to contribute to any kind of local economy. So basically, I started to speak about healthcare because I've seen firsthand how it doesn't work and how it's not affordable. And I'd say that I am lucky that we do have a health insurance, but I can't say it with a straight face. We are one of the 1.6 million Virginians spending more than 10% of our income on healthcare costs, and we fall into the uninsured category. And that's why I'm asking Senator Warner and Representative Perriello to support an affordable healthcare plan that includes a public option to increase competition. I tend to think of issues in terms of how people are affected by them, and the ways that fathers and mothers lose sleep at night, like myself. I see healthcare as a right and not a privilege, and as a moral imperative instead of a cost-benefit analysis. But if I can't appeal to you through, humanity and equality, let me at least appeal to you through rationale and reason. In a society that takes pride in values like creativity and entrepreneurship and opportunity, it is becoming increasingly difficult for industry to survive with the current healthcare system. And in a society that values competition, it's being impossible to compete. It is time to let our elected officials know that they work for us. And if healthcare reform is not made accessible and affordable, then they too, like the thousands of other citizens, their jobs too are not safe.
Jason Bain with the Virginia Change That Works campaign, and today we held a rally for affordable health care reform, calling on our Virginia congressional delegation to support the health care reform bill that was introduced yesterday in the House, to support affordable health care, because after all, if reform is not affordable, it's not reform. To support more accessible reform, and to support the public option that would increase competition and make more people eligible for coverage.
Thank you.